Well, on any given day, you probably don't pay much attention to your ears, unless, of course, something is wrong with them. And many times the problem can be tracked to an area called the eustachian tube. Now, Dr. Darryl Willett with Ohio ENT and Allergy Physicians is here with more on why those pesky ear tubes kind of give us so many problems. So good to see you again.
Thanks, Robin. I appreciate that. Yeah, today we're talking about eustachian tube dysfunction. And unfortunately, it's one of those very common problems that we see several times a week. And what the eustachian tube is that pesky natural anatomic tube that goes from your ear to the back part of your nose. And on this model you can actually see this is the opening of the eustachian tube in the back part of your nose. And if you're unfortunate enough to have chronic inflammatory conditions like allergies, chronic sinusitis, or nasal congestion, or you're just a little kid with chronic stuffy nose and sinus problems, you're going to block off from swelling the opening of this eustachian tube, and that leads into the problems.
That's where you get the issue. We notice a lot of times, even as adults, right, when we're on airplanes, and you feel that kind of pressure build up. So why is that why our ears are hurting so much when we fly?
Absolutely. And usually what happens is it's on the descent of the plane. As that plane is starting to come in for the final approach to the airport, you feel that pressure building up. And what's happening is there's a differential of the atmospheric pressure in the fuselage versus your middle ear space. And it starts to suck your eardrum in like a vacuum, and it hurts. As an adult, you might feel some pressure, hearing loss. You might say, gosh, if you just took a needle and popped my ear, I'd feel better.
Yeah.
Unfortunately, the kids can't do that, and they're screaming their heads off.
Right. So what can we do? Is there a way to prevent it or deal with it after it happens?
Well, prevention first. And for those people that typically have trouble with their eustachian tube on flights, I tell them the best thing to do is get a bottle of Afrin. Buy it over the counter. It's just a decongestant. And while you're sitting in your seat on the plane, squirt 2 squirts of Afrin in each nostril, and it'll actually start kicking in and decongest that tissue in the back part of your nose so that the eustachian tube ventilates a little bit better. Keep in mind you have to have less than 3 fluid ounces to get past the TSA, and there are some issues with using Afrin long term, which are another issue that we can talk about later. Aside from using Afrin, you can use Sudafed or Advil, cold and sinus. That'll also help systemically, but you have to use that about an hour before the flight. So you got something immediately that you could use, something that you have to plan ahead. You could also use a nasal steroid spray, which is either prescription or some of these are over the counter now, but you have to use that earlier in the day, several hours before, for that to actually kick in. The ultimate thing is I could always put a tube in your ear even as an adult, and that will help out.
And that's what we see a lot of times with kids. So if we have kids, though, on this airplane screaming, they can't take Afrin or they're not old enough to be able to take some of those drugs.
Right.
So what do we do for them?
Well, a little bit at the mercy of the pilot trying to get the pressure in the plane set up properly. But the unfortunate thing is you have to plan ahead. So if you're thinking that my child might have an issue with the descent, have a bottle ready to go or a sippy cup, or maybe even a pacifier. And as that plane starts to come down, you slap that in that child's mouth, let them suck on it. And that sucking motion will open and close the eustachian tube and start to ventilate their ear. That's the only thing, the best thing that you can do with them at that stage. Older kids, you can give them a little stick of chewing gum, and that will help open up their ears.
Okay, the other thing we're going to talk about is scuba diving. People might not do it that often, but when you do, I know pressure can be a real problem there.
Absolutely, and it's the same phenomenon as a plane descending. The deeper you go, the more atmospheric pressure is put on your ear, and your eardrum continues to get sucked in. Now, if it continues to suck in and pressure builds up, you can rupture your eardrum, or even worse, rupture the inner ear membrane and have hearing loss and dizziness associated with it. So likewise, if you're having trouble with your eustachian tube and you really need to go diving, you can use the Afrin before you get on the boat. You can use a little Sudafed, but as a professional diver, they'll say you shouldn't probably do that to mask the symptoms.
Right. Okay, well, kids get a lot of ear infections. Is that related directly to that?
It's all about the eustachian tube. What happens is the child will get a cold or an upper respiratory tract infection, and all this swelling that occurs inside their nasal passage and drainage will block the eustachian tube, and that puts pressure, negative pressure on the ear, and the eardrum will suck itself in, and fluid will collect into the middle ear space, and that gets infected.
Hence causing the issue. Probably the same thing for adults, right? When we get colds, that pressure build up there?
Absolutely. Not as common for adults as it is for the kids, because the kids, their muscles in the back of their soft palate don't work as well as you and I.
Okay, so the best advice, if you have issues with that, go in and talk to an ENT expert, kind of figure out what you can do before you get on that flight.
Absolutely.
All right, Dr. Willett, thanks as always for being here.
Thank you very much.